I'm sure many of you have been in a situation where you're at a hospital in an emergency room or a resus room after a serious injury or even a serious illness, maybe for yourself or sometimes for a loved one. And that's also sometimes maybe in a hospital scenario where you had to stand next to the deathbed of a loved one. Very, very horrible experiences. And many times I'm convinced that there was this need that you wish that you had somebody that you can talk to. My name is Japie, for those of you that don't know me. And what I'm doing is I'm coordinating an effort where we would really like to help and support people in an emergency room or a resus room or in an ICU in a hospital that goes through these very bad experiences. So it's for patients, it's for family members, but also for the medical staff. We must never forget the medical staff that must go also through these things, and many times on a daily basis. So what we would like to do is to be there for for people that goes through this very bad experiences. At the moment, we are doing it in 6 hospitals. We are supporting people in 5 hospitals in Johannesburg and 1 in Pretoria. And it's a wonderful opportunity for us to be there. But we've got a problem. At this moment, our capacity just doesn't satisfy the demand. And it happens many times that we receive phone calls and we can't go out and help people because we just don't have enough people, but we also don't have the resources to pay the counselors that must go out. So what we try to do is to make sure that whenever we receive a phone call, that we are there for the family members or the patient or the healthcare personnel as quick as possible. And that can be, most of the time, we send out what we call a trauma counselor. This trauma counselor will assess the situation, and if there's a need for a psychologist or a social worker or even spiritual workers to get involved, then we will refer that situation to them. But if the trauma counselor can't get out to the patient, we lose the opportunity to help and support somebody. So many times the hospitals that we are currently work in, the hospitals will pay us to come and help and support the patients and the family members and the healthcare workers. And that's wonderful. To be in the situation where the hospitals can pay the trauma counselor to go out. But most of the time, the hospitals can't pay us. They don't want to pay us. They feel it's not necessary. But we know how big a difference this makes for the family members and the patients and the healthcare workers when we're there to help and support them in these difficult times. And even more so when we go forward in this COVID environment that we are in, and we're now at the brink of well, let's hope it doesn't happen, but there's all indications that we might get a second wave. And the stress that put on the whole healthcare system in the country is going to be really a big issue. And we already see that healthcare workers are really struggling. A healthcare worker must go out and help and support somebody that they don't know. They must put their lives at risk so that sick patients, injured patients can be helped. So what am I asking today from you? I'm asking you that you would consider to go to my Patreon account. My Patreon account gives 3 options where you can help and support us. At the lowest level, I promise that if you sign up for my Patreon account, that I will give you a daily motivational or spiritual talk, short writing that I will send out. And if I can't do it on a daily basis, at least every second day, there will be a writing that hopefully can make a big difference in your life. And then for the second tier, I will also add a book review on a spiritual topic or a motivational topic that can help anyone that can make use of this. And then on the highest level, the third tier, we will go as far as saying that whenever you're in a situation where you need a trauma counselor, a psychologist, or a social worker, or even a spiritual worker, that we will be there for you to help and support you when this is in the context of a hospital environment. In other words, you get injured or you get seriously ill, and you need a psychologist or a social worker or even a trauma counselor, that we will guarantee you that we will give you that service for free if you a top tier subscriber to the Patreon account. So if you subscribe, help and support us, what that means is that we can use those funds to, whenever we get a call from a hospital where the hospital management is not supporting us financially, that I can ask a trauma counselor to go out and we can use these funds to cover the costs. But without this, we just can't do it. It's not fair to a trauma counselor to expect them to go out and do this wonderful work, and we are not able to pay them. So this way, you can make a massive contribution to people's lives when they really in difficult situations. And we're not talking about general, just a light injury, not serious illness. We are talking about people that really need the service. And over the last couple of months, it happened many times to me that I could just not send somebody out where they were in need. And I appeal to you, please go to my Patreon account. It's really not a lot of money. But if everyone is just contributing a little bit, then this way we can expand the service and make sure that we're there for the people that really needs the help. So thank you for your